The CMU Emergency Medicine program is unique because we've been established for over 25 years. We have an exceptional opportunity to work at 2 different hospitals in our community, at My Michigan Saginaw as well as Covenant Healthcare, and a curriculum that just can't be beat.
It is unopposed, and that is a great benefit of this program. You're going to be doing all of your splints, your reductions. You're going to be leading the trauma cases with the trauma surgeon. It'll be your responsibility, so there's no doubt in my mind that you're going to leave the program knowing what to do as an independent doctor. You're going to learn medicine no matter what program you're at, but the thing that sets this one apart is that you get a family out of it too. You're going to get very close to your colleagues, you're going to get very close to your mentors, and you're going to have all the tools you need that if you do want to jump into fellowship later, or if you do want to jump into some sort of medicine field after this, you'll get all the right tools you need to get there.
This is one of the best simulation centers that we actually have in the state of Michigan. It's state-of-the-art, over 10,000 square feet, exceptional staff and faculty there to support you. We have a well-honed ultrasound program that is one of the best in the state, leading to multiple residents going into ultrasound fellowship.
It starts from this terrifying, nerve-wracking experience to, wow, look at yourself 2 years later and you're comfortable, you know how to use everything, you know your resources, you're taking care of your patients, you're confident, and I think it translates well when we start working our shifts in the ER and you see our transition from our first year to a third year.
We have a really broad patient variety here in the Saginaw community, and we are the northernmost emergency medicine residency in the state of Michigan. We are right on the edge of an urban environment as well as an agricultural community, and we cover 20 counties. That is a lot of patients coming to us for care.
Even though we're a Trauma 2 center, we still get plenty of Trauma 1s. You will see everything that you need to be prepared in emergency medicine.
We pack a lot into 3 years, and our residents are ready to go when they graduate our program.